Hi, my name is Dennis Dickson. I'm a neuropathologist at the Mayo Clinic in Jacksonville, Florida, and director of our brain bank. And with me is...
Hi, I'm Tanis Ferman. I'm a neuropsychologist at the Mayo Clinic in Jacksonville, Florida.
And we're going to tell you something about Lewy body dementia. And both Tanis and I have been working on Lewy body disease for a number of years. Some of my first studies of Lewy body disease was as a resident at Albert Einstein College of Medicine in New York more than 25 years ago. And Tanis, we first became acquainted with each other actually through Lewy body disease when Tanis submitted her R01, or Individual Investigator Grant, on dementia with Lewy bodies, which for me was an exciting application to read, because it was the first application that I knew of where somebody was actually proposing to get funding from the National Institute of Health to study Lewy body dementia. And so Tanis, you can tell us more about what Lewy body dementia is in terms of the way it presents clinically.
Well, I'd be happy to. I do want to make a point that Dr. Dickson is the world-renowned neuropathologist who's probably done the most work in Lewy body disease, and was one of the first to discover many aspects of Lewy bodies, and you can talk a little bit more about that later, so I won't comment on the specifics, but it's been very exciting last number of, about 12 years or so that we've been working together. And one of the key features of the work that we've been doing is really trying to focus on the early detection of Lewy body dementia. And Lewy body dementia is a neurodegenerative disease. It's a condition that affects the brain cells, and as with many neurodegenerative conditions, it likely affects an individual long before the individual knows that they even have any changes that are occurring. And as time goes on, the nerve cells can become affected, and we actually now know through much of the work that Dr. Dickson has done that you actually can reach a threshold or a certain amount of damage before you actually will see a change in function. Patients with Lewy body dementia have a dementia, and a dementia is when there's a change in abilities that's more than would be expected from normal aging. So an individual may have a change in thinking, or a change in memory, or a change in abilities, but that change affects their ability to manage day-to-day activities. And that's different than what might happen in normal aging. And what we've been trying to understand is also how that is different from other neurodegenerative conditions such as Alzheimer's disease. And so over the years we have worked very hard to try to figure out what is going on in Alzheimer's disease, what is going on in Lewy body dementia, and to try to figure out what the earliest features are in Lewy body dementia so that we can best help our patients. And there are a certain constellation of symptoms that we have been able to identify, not just us, but other researchers in the field. And these constellations, or these features, include visual hallucinations, which may occur in some patients, not all, but in some patients they may see things that aren't there. Some patients may also experience what are called fluctuations, a change in one's ability to pay attention or to stay awake. And this can be very, very frustrating, particularly for family members, but also for the patients. I've had many family members tell me that they just can't believe that their loved one is really doing this. And is it truly a symptom, or are they faking it? And I've often asked them, well, what do you mean by that? And they'll give me a wonderful example where perhaps they will be able to figure out the microwave one moment, and then the next moment they'll go up to the microwave and they can't figure out how to use it, and then later on they can go and figure out how to use the microwave again. And that's one example of a fluctuation in one's cognitive ability. Other types of fluctuations may be more along the lines of arousal, where there's a lot of excessive sleepiness or drowsiness. And other symptoms of Lewy body dementia include Parkinsonism, and this is one of the symptoms that I think people think of most often when they think of Lewy body dementia and Lewy body disease, is a stiffness, slowness, balance problems, sometimes tremor, but not as often do we see tremor, but you can sometimes see tremor in patients with Lewy body dementia. And patients who have Parkinsonism may also have cognitive problems and thinking changes, and when that happens, in Lewy body dementia, sometimes it's often a matter of when it occurs. Does it occur early relative to when the onset of the Parkinson's happens, or is it something that occurs after 10 or 15 years of the Parkinsonism? And so we try to figure that out and help patients to manage that and understand that. And again, much of the work that we've done has been in comparison to Alzheimer's disease, because Alzheimer's disease is the most common cause of neurodegenerative disease, and in fact we are sure now that Lewy body dementia is the second most common cause of neurodegenerative disease. And the other clinical feature that we've done a lot of work on at the Mayo Clinic with our colleagues in Rochester as well is a sleep disorder called REM sleep behavior disorder. And this is a condition where an individual, while they are asleep, does not have the normal paralysis that will occur during dream sleep. So the individual, while they're asleep, may actually start acting out their dreams. It may look as though they're punching or kicking or hollering out or running or engaging in what looks like a dream, but the person is actually asleep. And often it's the case that the person's been doing this for years and years and years, perhaps even 20, 30, 40 years, many, many years. And we've learned that this may be one of the very earliest signs of neurodegenerative disease. Now, we have learned through our studies that not everybody who does act out their dreams has Lewy body dementia later in life. But again, this is one of the things that we're trying to understand, is who is at risk for developing Lewy body dementia, and how does REM sleep behavior disorder factor into that, and how does sleep in general contribute to Lewy body dementia as well. So our research has really tried to find, if you will, a clinical signature or a neurological, neurocognitive signature to try to characterize Lewy body dementia. One of the other things I didn't mention is that there does seem to also be a cognitive profile or a cognitive difference that can distinguish Lewy body dementia from Alzheimer's disease. And this is helpful to understand, especially as patients are extremely frustrated with their day-to-day functioning. Perhaps there's a little forgetfulness, and they'll come to the clinic and they'll explain that they're just not remembering things. And even though most people who come to see me will have the complaint of memory, sometimes it's not always memory. Sometimes it's an attention problem. Sometimes it's a vision problem. I'm misplacing things. I can't remember where I put them. But in fact, it's really all the objects are in front, but the person just isn't seeing what's in front of them. So in Lewy body dementia, we have learned over the years from the research that we've done here at the Mayo Clinic and that others have also done in the field, that visual perception problems and attention problems are disproportionately affected in Lewy body dementia. And in Alzheimer's disease, it really is more of a memory problem.